quick. I want you to hear this. So again, I met Mr. Houston a couple of years ago. During the African American Parent Network's Black History Month celebration here in Paramount, where he did a shortened rendition of the Dr. Martin Luther King "I Have a Dream" speech, and I was blessed to have my son present at the time. And hear me when I tell you, if you would have closed your eyes, you would have swore you were there, right? He did
Wow.
such a phenomenal job. We're talking flawless. I'm not a historian or anything, but I do look for the ahs and ums when people speaks and a yeah rights and the likes and all this other stuff. Like. None of that. The man went from the first word to the last word as if he were being channeled with Martin Luther King from heaven. I was like, oh my God. And it was so great that my son and all the other children that were present, they responded like, oh my God, did we just hear this? And that was the one time where I can actually see a bridge built between the younger generation and the newer and the older generation through his words. So that for me, it's an absolute treat that he's on right now, and I'm looking forward to him, doing it again. And I'll make sure everybody gets that
Bless
message.
Bless you,
Hello,
brother.
everybody. No, yes. Introduce yourself, Mr. Houston, please.
I'm here, everyone. I'm Larry Houston. I'm an educator, hopefully soon to retire. Not 65 yet, but I am very interested in knowing what Medicare is and all those types of things regarding retirement. Got to take care of myself and make sure my wife is covered and family.
Amen. Amen to that. I got
Well,
a
very,
chance.
very good. I think that's a good segue. It's 5:01 now, and I respect everybody's time. And
So
I
you're not
am
going to fill my opportunity to introduce you, though. That's not happening. Come on.
Okay, well, Tony, it's 5:01, so let's get going. It's 5:02.
Well, I usually start at 5:05, but since you're the instructor today, we're going to start right now. So again, thank you everybody for jumping on, all our guests and fellow agents and colleagues. This is a rare opportunity for me to be able to present a young lady that I've been working with over the past couple of years. I met her actually at a wedding, if you could imagine that. And her and I and another friend, we all hit off, and next we become business partners. And we thought it'd be a great idea for us to do this presentation today, particularly because of some of the changes that we've had in recent weeks, actually, since the last election. And this is my opportunity to present someone to you that's been in the industry for several years, but her heart and her passion for this industry, the Medicare industry, is absolutely top tier. And there's no one that I would suggest better than Miss Ragan Adkins-Small to be able to deliver this information to you. So without further ado, it is my honor, pleasure, and privilege to introduce Miss Ragan Adkins-Small.
Thank you, Tony, and thank you everybody for being present. I really appreciate you coming to listen and learn. And so I am going to stay on point, stick to my script, so that I cover all the basics, which you're going to see something that says Medicare basics, and so that you can start building your questions. And with that said, I'm going to first ask everybody to make sure they're muted in case, they're in a home with, animals or lots of family or something, so that everybody can hear and not miss anything. Okay. And I'm always happy to repeat. Secondly, I would like to also mention that, and Tony mentioned things that we've been hearing in the news as it relates to the Donald Trump administration. There's a lot of things in the news right now with regard to Social Security and Medicare and Medicaid. As agents, as brokers, we have not been alerted or updated on any immediate changes because we don't know how it's going to affect yet, or if it's going to have any effect at all. So I know that you may have questions, but I simply cannot answer anything with regard to changes that may be coming from the administration. So I just wanted to put that at the outset in case some of your questions were regarding, came out as well, what if I get in and I just can't answer any of those types of questions yet. So this is really a Medicare 101 training for you, as if you are turning 65 and will be enrolling in Medicare soon. But this is good information for everybody to have, okay, because we will all go on that journey one day soon. Okay, so again, that said, we're here. Again, my name is Ragan Adkins-Small. I am 5 years in Medicare. I am a licensed health and life license in California, Arizona, Oregon, South Carolina, and Nevada. Okay, so I have 5 licenses, and I am certified with 13 health plans. That is an annual certification that I must go through, pass the test, and be appointed with a ready-to-sell status. If I don't get my ready-to-sell status from all of these carriers, I cannot talk to you about a particular health plan. If I didn't have my ready-to-sell status with Anthem Blue Cross, I could not talk to you about Anthem. Okay, so I am certified and ready to sell with all of these different plans. Okay, so we're here to talk about Medicare. What is Medicare? So Medicare is a federal health insurance program for individuals that are 65, turning 65 or older. Medicare is also available to people that are younger who are disabled with end-stage renal disease or ALS, amyotrophic lateral sclerosis, okay? Also known as Lou Gehrig's disease. Okay, so it's very specific when it comes to younger people being on Medicare. Okay, now, how does it start? Well, like I said, you're turning 65 and you are either not working or you are working, okay? So you enroll in Medicare through the Social Security Administration. So if you're doing it online, you would go to ssa.gov and you're deciding, well, is it time for me to do it? If you're turning 65, yes. If you're working, you can put it off a little while, because if you have group health coverage, group meaning you are working and your job offers you health insurance, you can put off enrolling in Medicare until you retire, or you can go ahead and retire. Because if your employer is large enough, Medicare becomes your secondary coverage. Your job is primary, Medicare becomes secondary for you if you are working. Okay, so Medicare, and Tony, can I ask you to flash the card, please? Okay. Many of you have probably seen this card before, perhaps whether it was on a commercial or your parents or your grandparents. That is your ticket into Medicare. Once you receive this card with your name, your Medicare ID number, and your Part A and Part B, you are what's considered a Medicare beneficiary. As it says right there, name of beneficiary, okay? That is your card. That is your proof that you have enrolled and you were entitled to Part A and you are paying for Part B. Okay, so Tony, can you take it to the Medicare basics now? Thank you. Okay, so what is Medicare? There's 2 parts to Medicare. Original Medicare, and that's Part A and Part B. So initially, when you get your red, white, and blue card, you're going to see that it says Part A, hospital insurance. And with that, you will receive all the services that a hospital can offer you, okay? And these are the current rates. For the deductible for Part A insurance is $1,676, and that's of course for the whole year. And then for Part B, the premium is $185. Now let me make a distinction here. Most people do not pay for Part A. You don't pay for Part A because you are entitled to it because you have worked more than 10 years in your life, okay? And depending on, as long as you were a W-2 employee and your employer was taking taxes out of your check, one of those taxes that they were deducting was to pay into Medicare. And you were specifically paying into Part A. And that's why you don't pay for Part A. You are entitled to it. Now, when it comes to Part B, that's where you make a decision. Am I ready to get Part B? Am I ready to have both? And so when you are ready to have both, you will start to pay for Part B. And then that's when you receive a card that has A and B coverage on it. The card may have the same date for A and B, or oftentimes it has different dates. A may have started a year before B. It could be several years before you started Part B. But that's what your card, like I said, like I showed you, your card is A and B, and A covers your hospitalization, and B covers all your services that you receive from your doctor, whether it's going to get a physical, or it's you are hospitalized and you're seeing the doctor, or you are having to go into the doctor's office to get a particular type of medication. There are certain medications that must be administered by the doctor. It's not something that it's not a pill that you take home with you. Your doctor must give you a Part B medication in their office. Okay, so that particular medication is called a Part B medication. Okay, and you can see what the annual deductible is for Part B. Now, let me make something clear. When you just have original Medicare, that is simply your red, white, and blue card, and that's all you have, you will pay a deductible for Part A and a deductible for Part B. Now, when you only have original Medicare, you must also have what you see below called Part D. Those are your prescription drugs. You must have a separate standalone plan to buy your prescription drugs. Okay? And in this situation, you are paying two premiums. You have your Part B premium of $185 for 2025, and then you would also have a premium for your prescription drug plan. And this year, the prescription drug plan is as low as $17 up to $450. It just depends on the carrier that you go with and what your needs are. Your needs are very, very important in determining which plan you go with. So again, if you choose to only be enrolled in original Medicare and only carry around your red, white, and blue card that will cover your A and B, you must also have a plan that you buy your prescription drugs through. Now I'm going to move to Part C. Part C is called Medicare Advantage. So this is where you exercise your options. First and foremost, the utmost requirement is that you always pay your Part B premium. Okay, that's the $185. And I'm going to stress again that it's $185 in 2025 because it could go up or go down in 2026. So you've decided, well, I don't want to be on original Medicare because it's an 80-20 plan. Medicare pays 80% of your cost and you pay the other 20%, okay, for your doctor's visits, hospitalizations, tests, and whatnot. And that 20% could come in at a hefty price. So you decided to explore what Medicare Advantage has to offer. Now, Medicare Advantage is private, whereas original Medicare with just A and B are from the federal government. So Medicare Advantage is private. Private in what way? It is offered to you through the private health insurance carriers, such as all the names that you've heard: Anthem Blue Cross, Blue Shield of California, SCAN, United Healthcare, Alignment, WellCare, Humana, many more, WellBe, LA Care. So there's a number of plans that have a Medicare Advantage offering. And the difference between Medicare Advantage and original Medicare is there's a lot of differences. First of all, if you choose to go into a Medicare Advantage plan, it is either HMO, they have HMO plans for you to choose from, and they have PPO plans for you to choose from. And they both can come at a zero premium every month. So you can be in a Medicare Advantage plan and have no monthly cost. Your ongoing monthly cost when you have Medicare Advantage is what? Your Part B premium. You must continue to pay that Part B premium in order for you to stay in a Medicare Advantage plan that has no monthly premium. When you're in a Medicare Advantage plan, whether it's HMO or PPO, you get all the benefits of A and B, hospitalization and doctor services, as well as your prescription drug plan. So Part C includes A, B, and D. Okay, so instead of having everything separate all over the place, if you're in a Medicare Advantage plan, your A is covered, your B is covered, and your D, your prescription drugs, are covered as well in a Medicare Advantage plan. Once again, pay your Part B premium of $185 and pay for the cost of your medications. When you're in a Medicare Advantage plan and you have to purchase medication, the medications are on a tiered system. If you take a lot of generic medications that are widely dispensed, you may find that you don't pay for any of your medication because they're on tier 1 and tier 2. So prescription drug plans are tiered up to tier 5, sometimes tier 6, but you'll always find that tier 1 and tier 2 have no costs, okay? And as mentioned here, costs vary depending on your plan choice. All plans do not have a deductible. So when you're talking about a plan with for your prescription drugs, that's referring to a standalone prescription drug plan. But if you're in a Medicare Advantage plan, you don't have to have a separate prescription drug plan because Part C, also known as Medicare Advantage, rolls A and B and D all into one plan. Okay, and so it's an HMO plan, which means it's managed care. Managed care, which means you will elect a primary care doctor, okay, and your primary care doctor on an HMO plan will guide all of your care. Your primary care doctor will refer you to a specialist if ever you needed a specialist. On the other hand, if you are in a PPO plan, under Medicare Advantage, you have the option of choosing your own primary care doctor as well as your own specialists, and you don't have to get a referral. I'm sure many of you have experienced waiting for a referral. And when you're in a PPO plan, you can self-refer. You don't have to wait days and weeks, sometimes even longer, for that referral to come in writing to your home. You are self-directing, excuse me, to a specialist that you need. Okay. And so let's see here. Where are we in this? Oh, let me move on to, I'm sorry, let me go back to something about Part A and Part B. When you stick with original Medicare, which is just A and B, you are allowed to choose your own doctors. Okay. You choose your primary care doctor. You choose a specialist that you may need. You can choose that doctor all on your own. And you want to make sure any doctor that you are seeing has a Medicare contract. Because if that doctor does not have a Medicare contract, that doctor can overcharge you. And no one wants to be overcharged. So when you need a specialist, you can always ask your primary care doctor, hey, who would you refer me to? Who would you refer your parents to? That's always a good question, because they're going to refer their parents to someone who they respect in their field. So again, if you are in original Medicare and you're staying in original Medicare, you guide all of your care. You pick the primary care doctor, the internist, the family medicine doctor. You pick your specialists. But when you're in Medicare Advantage, you're going to pick your primary care doctor, but your primary care doctor is going to pick your specialist for you, because they tend to be in the same group. In fact, they have to be in the same medical group. I call it where the doctors live in the same home. Okay. They are housed together in a medical group. Maybe you've heard the name Regal Medical Group or Optum Medical Group. Okay. Those are groups of doctors where there's the primary group and then there's the specialists, and they work together. They agree to refer each other. That's how that works. And they're also managing your care. They're communicating with each other on your needs. And so that's what managed care means. All right, let me move on to what a Medicare supplement plan is, also known as Medigap. Okay, Medicare supplement, or Medigap, is a plan that first and foremost has 3 premiums. And you have to be very careful when you get into a Medicare supplement plan. If you get in right when you're turning 65, you will avoid underwriting. So now, what is the benefit of a Medicare supplement plan? Medicare supplement plans are accepted nationally. It is a true PPO plan. If you, as we all do right now, we live in California. I believe everyone on this lives in California, or if not, it's okay. You choose a Medicare supplement plan because you want to make all your own choices, okay? You want to, perhaps you travel to see family frequently, grandchildren, adult children. You have a home in another state, and you may spend weeks or a month there. And you want to know that should anything happen to you, you can see the doctor and it's not going to cost you a lot of money. So if you have a Medicare supplement plan, you can go to see any doctor in the country that you want to see, as long as they have a Medicare contract. Okay. Now, difference in cost. Medicare supplement plans are age rated, community rated, zip code rated. And so there's a lot of areas that you have that are part of the criteria for setting your cost. But if you get in a Medicare supplement plan right as you're turning 65, your cost might be $125 a month for that Medicare supplement plan. In addition to your Part B premium, because remember, you've got to maintain that. So you've got your Medicare supplement plan coming in at $125, your Part B plan coming in at $185, and then you must also get a prescription drug plan or Part D plan. So you have 3 premiums when you have a Medicare supplement plan. And a lot of people do that because they love the flexibility. They love the flexibility of the plan, directing their own care, no referrals. So it works for a lot of people. If you go into a Medicare supplement plan at age 66, that's when you're going to have underwriting. And what is underwriting? That's when they're going to ask you to fill out an application. And typically, if you answer yes to any of the questions, they're health questions, mind you. Do you smoke? Have you been diagnosed with diabetes or cancer? If you answer yes to any of those questions in the beginning of the application, you will not be approved. So if you decide at some point to explore a Medicare supplement plan and really think that you want to go with it, make sure you get it right when you turn 65, okay? Because you don't want to have to answer any underwriting questions. Certainly if you have any chronic conditions. And let's see. So that covers Medicare basics. I left out a lot because I don't want to confuse you. I left out anything about Medicaid, or in California, we call it Medi-Cal. I don't want to include that because it's not a part of Medicare basics.
Okay.
But it does.
My hand hit something. I can't figure out how to undo it.
Who?
I'm sorry, did
Mr.
someone have a question?
It looks like it was Regan Houston, or is it Reagan Houston, like my name?
It's Regan. My hand hit something. Sorry for disturbing. My hand hit something
it's
on here.
okay.
I can't figure out how to mute it.
The little box in the upper right corner, it'll say mute or unmute.
Don't worry, I got you.
Okay. Oh, you can do it, Tony. Okay. Okay. So that's it. And so I'm ready to take on all the questions.
I had a couple of them in the chat room. Pastor Josie asked about the $185 that she said, is it monthly or annually that you'd be paying?
So Pastor Josie, your Part B premium of $185 is paid on a monthly basis. And the way you pay your Part B premium is at the most basic ways, 3 ways. You either pay it directly, write a check, do electronic withdrawals from your checking account, or for those that are retired, it's usually the 185 is usually withdrawn from their Social Security check. So if they're retired and receiving Social Security benefits, let me make that distinction. You can be retired but not receiving Social Security yet. But if you are receiving Social Security and you apply for Medicare and Part B, they immediately take that Part B premium from your Social Security check. If you are retiring from the railroad, they will also deduct it from railroad retirement benefits, because they can't just automatically withdraw it from anywhere else. So you have to allow them to withdraw it from your checking account or your Social Security benefits or your railroad retirement benefits. That's it. That's it. That's how you pay that Part B premium, and it must be paid monthly. There is a grace period. I have a client that forgot to pay her Part B premium for almost 6 months. On that 6th month, they canceled her. She had no idea she was canceled until she went to the pharmacy. She thought she was walking in there to spend $30. They told her your bill today is $1,000 because she no longer had the protection of Part D to lower the cost of her medication. That's why it is so important, especially for those on maintenance medications, to make sure their Part B premium is paid, because oftentimes you either find out when you're going to a doctor's appointment, they tell you, oh, I'm sorry, we can't see you today because you no longer have coverage, or you're walking into the pharmacy to pick up your medication and your costs have soared. And the pharmacist can't tell you, well, you didn't pay your Part B. They don't know that. But all they know is that they cannot give you your medications at the cost that you were expecting to pay. And then you go back to your plan and find out, oh my God, I forgot to pay. So that is why it's so important to continue to pay your Part B premium the easiest way that you can pay it. And that's through electronic deductions from your checking account, or again, if you're receiving Social Security benefits, let them take it out of that check.
All right. I had a couple real quick. I want to jump in there. So just at the end of your presentation, you were saying that it is essential that you apply for Medicare while you're 65 as opposed to 66, so you don't have to worry about any audits or anything. What?
So Medicare is for those who are turning 65 and older. However, if you're 66 or 67 or even almost 80, like one of my clients, he didn't have to apply for Part B until he retired at almost 80 years old because he was covered. He had insurance at his job. So you're protected.
Got it.
And so that worked out for him.
My second question is, what if you work a job that does not pay into Social Security? Well, how does that affect your Medicare? And
if you work for certain, certain entities,
state level, they don't pay. They pay into CalPERS and CalSTRS, I believe.
Correct.
They do not pay into Social Security.
Correct. And so they're, because they have a pension, their health insurance might follow them. So it depends on how their retirement plan is set up. Mm-hmm. It all depends on how it's set up. Now I just enrolled a gentleman who is, part of CalPERS, but he did decide to enroll in Medicare as well. And so you've got all these set windows of time to get into Part D after you retired, and to get into Part B after you retired. So there's a window for Part B and a window for Part D. And so you just want to be aware of those windows so that you aren't hit with the penalties, because the penalties for late enrollment on Part B, your doctor, your medical services from Medicare, and Part D, your prescription drug plan, those penalties follow you for the rest of your life. And so you want to avoid that. If you are retiring from the federal government, you've got great coverage. Don't even worry about Medicare. You've got a great retirement plan. And again, so it's you don't have to rush to do it. If you are still working, you've got great creditable coverage, and your employer should offer you a letter stating that you have creditable coverage. Because again, you're 65, but you want to continue working. You're not ready to retire. And so you just want a letter from your benefits department that shows that you have true creditable coverage for health and prescription drugs. And the creditable part simply means that it is as good as or better than Medicare. Meaning it's gonna cover you the same way.
All right. I have one more question in the chat. Mr. Houston asked, is Medicare only for the individual or does it cover me and my wife?
Medicare is only for individuals. So whereas if you, when you're at work, you're the primary, and then you have spouse and children, or just a spouse or just children, whatever the case is, that's group. But when you're in Medicare, everyone stands alone. So you would have your own, you would pay your own Part B premium, and your wife would pay her own Part B premium.
Excellent. Thank you, Mr. Houston. Anybody else have any other questions? You mentioned Medicaid earlier. Now, Medicaid, Medi-Cal for everybody in California, and Miss Adkins-Small, we have people from Houston, Texas, Greenville, North Carolina on the call as well. And they have their family members that I'm sure they want to be able to share.
Welcome.
So with the Medicaid, and to Mr. Houston's question, would the Medicare affect the Medicaid for the family members, especially low-income family members?
So when someone is, it's a consideration when the primary or the most senior person in the household, you want to look at who's being covered on your plan. And so you have to come up with a plan, because you're going into Medicare, they're going to continue being on whatever they've been on. So you just have to make provisions. You have to make provisions for the family to continue their care. Perhaps if they're, obviously they're under 65, you can go on, if you're in California, you go on Covered California. Or if you're leaving a group health plan, so your job, and you've decided to go on Medicare, your family, each member on your group health plan will receive a letter that lets them know what their rights are. And their rights being that they can continue to be covered by the plan, basically, COBRA. The letter is offering them COBRA coverage. And so that way they continue to be covered for 18 months at a higher cost, unfortunately. Or if they're in the state of California and they don't want to go on COBRA, then they have the option of going on Covered California. And with Covered California, you can, if you qualify, you get a subsidy. So say your plan, say you're looking at a coverage that might be, I don't know, $800 a month full price. If you qualify for a subsidy, then that $800 is reduced to $150, because your subsidy is going to be $650 per month, depending on your situation, depending on your income, all your income sources, the size of your household. Does your income cover, one person or several people? The more people your income covers, if you're the breadwinner, your subsidy is huge. And so your out-of-pocket cost at the end of the month is reduced significantly by the subsidy. And so that's how the retiree who's going into Medicare continues to make sure their family members have some health insurance coverage. The family members, they're going to pay more than the Medicare beneficiary who's in the family.
Excellent.
But yeah, it's the big break in medical costs doesn't come until you're Medicare eligible.
Great. Right now we have a number of guests on the line, and I appreciate everybody for coming on. Mr. Houston, thank you so much for your question. Do any of the other guests have any questions this evening?
Is anyone of Medicare age yet? Okay, Tammy and Linda, and are you currently working? Well, Linda, I hear your name a lot from Tony. So you're in Texas, right? Oh, you're muted.
Yes, I'm in.
Tammy, are you also on the Texas team?
No, I'm in California.
You're in California. Have you started? Are you going to turn 65 this year? Oh, I'm sorry. I shouldn't ask that. Wait, let me say it this way. I'm so
No,
sorry.
no. Listen,
Double for that.
I've earned these years and these gray hairs, so I have no problems with it. Um, so I turned 65 last year, and I was
Mhm.
bombarded with literature, and it was
Of
so
course. Yeah,
confusing.
yeah.
And so I finally reached out to, I think it was there's so many organizations. Anyway, they scheduled an appointment for me to speak with someone who was going to walk me through and explain everything. And so I wanted to continue with the medical group I was already with. So
Mhm.
the individual I spoke with was like, well, I think this was in October. So they scheduled for me to speak with another rep in November once the new rules were in place. And so in November, I spoke with someone and we got everything straightened out, and I was all set to go and figured it was fine and tried to renew my prescription a week ago, only to discover for whatever reason, he never signed me up. So now I have to call them and start all over. Yeah.
Okay. So that's crazy. I'm sorry to hear that. Um, do you have a confirmation for your enrollment? Did they send you anything? It
No.
sounds like they
And
didn't.
and he told me, he just, you don't have to worry about it because you're not changing your plan. You want to stick with the same plan because there aren't going to be any changes. You don't have to do anything. And I just recently discovered that I'm not with the supplement plan that I signed up for. I'm with I think it's called WellCare, which I was getting, like I said, I was getting so much literature, and I have a bag of paperwork that I was planning to shred. Fortunately, I didn't get around to it because it turns out that my WellCare membership was amongst the mail that I thought was spam and junk because I didn't sign up for WellCare. I signed up for something else. But yeah, so I I have to call them back and work it
Well,
out.
Tammy, let me share this with you because I don't know if they told you. So from January 1st to March 31st, we are in open enrollment. Okay. And how does this differ from last year? Okay. From October 7th, I'm sorry, October 15th to December 7th, every year without fail. That is the annual enrollment period. Okay. Anyone can make a change. You're either enrolling in Medicare for the first time, or you've already been in it and you want to change your plan. You've seen something that is a better fit for you. That's what you do in from October 15th to December 7th. Now, January 1st, 2025 rolled around. Maybe it's the end of January. Like, I'm not liking this plan so much. So from January 1st to March 31st, you are allowed to make a change. However, January 1st to March 31st is only if you are in a Medicare Advantage plan. So if you enrolled in a Medicare Advantage plan between October 15th and December 7th, and come the end of January, you decide that you don't like that Medicare Advantage plan that you enrolled in, you are allowed to make a change to a different Medicare Advantage plan between January 1st and March 31st. This period of time is called open enrollment, and you are allowed to make that change. If you are on Medi-Cal or Medicaid, you can change every month. But if you're not on Medicaid, you can only change now from January 1st to March 31st. There's some other times when you can change, but that's because you've moved. Um, you're going into a nursing home that opens up what's called an SEP. you were affected by the fires, like it was just 2 blocks from me. So I live in Pasadena, and so I had to leave my home. But I'm not Medicare eligible, so none of that affected me. But if you were affected by that and you didn't get to do something in January, you still between January, March 31st, it opens up an SEP, a special election period for you, and you have to prove what thing impacted you. A disaster, in this case, a disaster impacted me, kept me from making a change that I have a right to make. And so it's not, oh, I'm locked in, absolutely locked in. No, there's some other opportunities to change, and there's a whole long laundry list of them, and they're called special election periods, and it only applies to you and your situation, not the whole Medicare eligible world. It only applies to you. So you have an opportunity, whatever it was you originally enrolled in, you can change it right now up until March 31st, even March 31st at 11:49 p.m. You could still change it, and whatever you change it to would be effective April 1st of 2025.
Thank you.
Sure.
I have Felicia. She'd like to ask a question as well.
Hi, Felicia.
Hi. I was just wondering because I'm eligible for Medicare, so I am receiving it. However, what I wasn't too sure about is like I'm getting select quote calls and all of these different agencies that are asking me, do I want to sign up for an $85 gift card and different things like that. And so what I found is that a lot of the doctors that they're saying are in network for different healthcare plans not been updated. So I was affected negatively by that. And I was just wondering like what the process is when you get those calls. Should they be trusted, or who do you go to actually figure out what the correct information is so that you don't make that mistake?
Okay, so Felicia, I'm going to say this very carefully. Okay. When a telesales agent contacts you, they're generally going to talk about the additional benefits to get you in, to get you to switch. So first and foremost, if you're already a Medicare beneficiary, and I'm going like this, like you have a card and you have your Medicare ID number, you want to guard that ID number because they can switch you with a quickness. They'll pull your plan right from under you. And of course, you won't find out until you go to the pharmacy or you're trying to make a doctor's appointment and they tell you, oh, well, we don't see that you're covered. Okay, so like, what happened? What happened? You cannot call your telesales agent and ask them to fix it for you. You can call me and I can fix it for you.
Okay.
So you always need an advocate when you're in Medicare. Be your own best advocate as well. But you do want to be able to talk to a licensed person at all times, a person who's licensed and very knowledgeable about the plan they're asking you, if you're a best fit for. Don't fall for the food cards. There are lots of plans that do offer a food benefit. Absolutely. There are plans that offer the food benefit. Certainly if you, the Medicare Medi-Cal plans, the Medicare Medicaid plans do offer additional benefits because it is known, it is found that if you have Medicaid and Medicare together, there's likely an income qualifier. You have qualified for that because you have low income. The other thing is that people often have chronic conditions. And so that's why they put a food benefit in those plans. What a lot of the Medicare Advantage plans also come with is an over-the-counter benefit quarterly. So usually the food benefits are offered monthly because people got to buy food every month, but you don't have to buy toothpaste every month. But there's plans that give you $125 every quarter to go into the stores like CVS and Rite Aid to load up on your wellness products. Okay, just your wellness things, your vitamins, your pain relievers, your wrist guards, your incontinence supplies, whatever it is that you use, you can take that OTC card and go in there and buy it. Keep your money in your pocket. But so just be careful when they're talking to you. But I'm more than happy to help you, just give you some more pointers. Even if I'm not your agent, I'm still happy to give you information so that you know when they call you what to say back to them.
And then one more thing that I had to add, because I heard the young lady ask about if the Medi-Cal is affected for other people in their family, if they have Medi-Cal. And it absolutely is. Like, once you start receiving Social Security benefits, they are going to your income. Because my son is dependent, but he doesn't have any income. So I tried to still have him under Medi-Cal, and they said I have $600 and some share of cost before it'll kick in. So it absolutely affected his ability to receive under me.
It something blanked out. There was like a shortage. I didn't hear everything that you said, but yeah, a share of cost is real. And share of cost kicks in because you're over the income threshold for Medi-Cal. And so anyone that has Medi-Cal and is paying a share of cost, it's because they went over the income threshold. It could be just a few dollars and they hit you up with that share of cost, and it could affect other things. But yeah, I'm happy to talk to you about that.
Yeah, so I want to find out absolutely if there's any way to go around that, or what's the best way to maximize that, or what would be the best option for me to get other health care for him. It's only really temporary for me because I am going back to work, but while I'm off work, I don't have $600 and some to pay for medical, and he needs to go.
So can we may I call you, or you call me after this, please?
Absolutely.
Okay, thank you.
Okay.
I'll make sure that your number is in the chat room, as well as I'll text that with everyone else. We have two more questions. One first from Ms. Tawana. Ms. Tawana, can you jump on, please?
Hi, Tawana.
Hi. I just really want to take a comment. I've worked with WellPoint and with Anthem and doing customer service. I technically still work with them. I just do the pharmacy side now. So I've firsthand witnessed the changes that were made because people had someone call them and try to sign them up or switch their plan and things like that. So I was like, yes, that really does happen. So I always tell them, they'll say, I want to know, is this real, or was it a scam or anything like that? And then I'll just tell them, make sure that they get in contact with their actual plan to, before they just give their information over the phone. And even what I do, I personally, when someone calls me, I'll say, I'll call you guys back, and then I'll call, and then they'll say, well, I'm not verifying anything over the phone because this is an incoming call, and my trust level is, with my information, I don't play with my information. So I think that's just really a good thing for people to understand, to make sure that they're giving, verifying certain things. And yes, those benefits and what's it called, rewards and things like that, they are real and they are in the plan. And I feel like what Miss Tammy was saying earlier, they do bombard people with a lot of information, and I noticed people don't read those packages. They don't read, and it's a lot. It's not a bad thing. It's just, it's so much, it's overwhelming. So it's always good to call and talk to a customer service agent to get those questions. And I think a lot, especially when you're turning 65, you're already dealing with maybe, having to change from starting with retirement. So that's a whole life change within itself. And then now, so that information and trying to adjust financially, and then now you're starting this new program, that is a lot for anyone 65 and older to handle. It's a lot for me, and I'm 44, right? So when I made certain changes, so I think it's really good that people just really reach out and call to verify. And honestly, this meeting particularly, I really wish it was more people that was in need, and that change is coming. And I feel like it needs to happen again, and more people need to be invited, because I feel like the information is very much needed for somebody to explain it to them and break down part A, part B, part C, and things like that, because it's not really easily explained. And again, people are not going to sit there and read word for word and understand it comprehension wise at age 65. So, no shade, is not saying that people, but a lot of people, it's just a lot. You have a lot going on at age 65. I'm not there, but I just know from talking to a lot of customer service people how overwhelmed, they're hurt, they're crying, they're worried, stressed. It's a lot. So I want to say I appreciate you, and
thank you,
Tony, for even bringing this to the forefront. And I feel like if you guys have it again, I don't know many people that are 65 and older personally, but I'll share it to see if everybody else can maybe bring some people in to hear this information, because I feel like it's really important. So thank you.
thank you. And let me share something with you that you mentioned. My sister-in-law, I wrote her coverage. She had it for, I don't know, a year or something. Then one day she calls me. She's all in a panic. Ragan, I lost my coverage. What happened? I don't know what happened. I'm like, who were you talking to? Well, I saw this thing on TV, so I called this company. I wanted this, I wanted to get the food card. Why? So she calls. Oh, they were waiting for her. They saw her coming. She immediately gave them her Medicare ID number. So here's what happens. You already have a plan. You decide to enroll in another plan. It immediately knocks out the one that was already there. It just goes away like it never existed. Only thing is, for her, the guy took her information, canceled out the plan she had, and never sent her any proof that she had been enrolled into the new plan. So now I gotta backtrack and jump over hoops and get her plan back and prove that, this happened and this happened and this happened, and get her plan back in order. And she is one of those people that has a lot of medication and must continue to take that medication and pay for it at a reasonable amount. That's why I say, please do not give your information to somebody, because it is so easy to switch somebody's plan, and the one that was in place just goes away. It just disappears.
And it takes time. The time frame that you probably took and that it takes to try to get that back.
Oh
going,
my God.
It's at least 30 to 90 days process. So imagine
it's a quick turnaround, but you have to.
In Texas, I've seen it go slow.
Now, and then if it happens at the time of year during lock-in, you really have to prove something to get back in that plan during lock-in, because you may not fit into one of the SEPs. And so I'm sorry, the special enrollment periods, there may not be one that applies to you. So we have to, really jump over some hoops to get somebody in. And so she's done it twice to me now. And I'm so tired of her. But I get her back in each time, because it's important. It's important for her to have it. It's important for anybody to not lose their coverage. And so I could just wish I could take her phone away from her to stop her from calling to try to get little benefits. Leave that for somebody else that
She's
really
lucky to have you. She's lucky to have
really, that really qualifies for it. Why do you want that? So anyway, she does that to me, but she keeps me on my toes. Trust me. Hello, right. Mr. Holiday.
Mr. Holiday, welcome to the call. Real quick, Miss Tammy Moore had a question, Reagan. Miss Tammy, can you jump on?
I just wanted to say, when I got I started out, I made a call, I think it was to Medicare or Medi-Cal, I don't recall. And this was last year. And they made the appointment for me to speak with a representative. And so then I didn't hear back from anyone. And so I called again and I was transferred. So somehow I ended up with someone with LA Care. And so they were like, oh, well, we don't know what the plans or what the new rules are going to be. So we'll schedule you to speak with someone. And so once the rules are in place, we'll make an appointment for you to speak with someone. They'll let you know if your plan has changed or not. And so I don't know if by calling the different numbers, I thought I was calling the right representatives. I have cards for each of those contacts.
Oh, I'm so sorry.
I think in the end, I was referred to a broker. And I think that's what happened is he switched me over to WellCare. And I don't recall, he may have asked me to verify my information. I don't recall exactly because, as I said, I spoke with so many people. But I started out with LA Care and Medi-Cal and Medicare. And I think with all the information and all the phone calls and the promises that somebody's going to call me back, when somebody finally called me back, I thought, oh, great, I'm finally getting somewhere. So for me, I think that's how I got scammed. So now I'm having to start over.
Okay, well, Tammy, I'm happy to call you and even take a look at what you have to understand where you stand, because it sounds like you're not sure of where you stand. Is that the case?
I do have a Medi-Cal card. So
is it Medi-Cal or is it a Medicare plan, a Medicare Advantage plan for?
Well, that's a good question.
Yeah.
Because it's LA Care Medi-Cal.
Okay.
And it was explained to me that LA Care is not Medi-Cal. They are a broker or an in-between. So it's not, the way it was explained to me, Medi-Cal doesn't have the staff to call everybody because there are so many people. So they work with LA Care. LA Care supposedly works with the patients or the Medi-Cal recipients and help them they don't tell you who to sign up with, but they're supposed to help you with any questions you have and provide any information you need so that you can make a decision. And so I started out with LA Care Medi-Cal, and they were the ones that scheduled the appointment for me to speak with someone to determine whether or not I wanted to switch plans. And I made it very clear I didn't want to switch plans because the medical group that I'm with, all else fails, I can walk to their office. So I and I was happy with that group. And so I wanted to stay with that group. And I was just as I said, the WellCare stuff was coming in along with all this other information. And I just assumed, okay, this is just more junk mail. Somebody else, Humana and all of these people are reaching out to me, United Health, all of these plans. And so I have a bag. That's how much stuff. I have a grocery bag.
No doubt about that.
Ads. And I just had not gotten around to it. And so when I went to the pharmacy to pick up my prescription, and he goes, oh, that'll be $250 for a prescription that I was paying $4.80. And I was like, okay, this can't be right. And so he looked through and he goes, well, you're not with this group, you're with WellCare. Who is WellCare? I never signed up for WellCare. So that's where I am. But yes.
Can I ask you to call me after? Will you call me after? Yeah.
Yes.
Okay, thank you.
Thank you.
All right. Before I end this, Miss Margarita, if you're still on, Miss Linda, if you're still on, did you have any questions before we jump off? And while they're debating that, I want to welcome Miss Thurman Holiday to the call. He's also a Medicare professional. I think this man is top tier, just like Miss Ragan Adkins-Small. Just wanted him to say hi. Say hello, Mr. Holiday.
Hello, everyone. Thank you so much, Tony. I apologize for being late. I was on another call and it just went way over. But I love the conversation. Ms. Moore, you're not alone, so don't feel like you are.
Excellent. Linda just came
every day.
Linda just came off mute. Did you have a question, Linda?
I did not. It was good information, though.
Thank you, Linda.
Thank you.
All right. Well, thank you all so much for being on. Thank you to all the guests for being on. We had a few people that had to jump
Thank you,
off.
everybody.
Yeah, let me know they had to jump off. So this presentation is recorded. For everybody that's going to be talking to Miss Adkins, this was awesome. Thank you, Deborah. I appreciate that. If everybody's planning on talking to Miss Adkins-Small, her phone number, I see applause. You got applause over there, Miss Ragan. Woo!
Oh, thank you.
All right. Her phone number is 626-784-7112. That's again 626-784-7112. Lock that in your phone. With everyone's permission that requested her phone number, I'm going to be sending her your phone numbers as well, so you can have a direct conversation with her. If anyone wants the information from this presentation, I'm going to be sharing the video link once I upload it to YouTube, so that'll be available in the next couple of hours. And with that, I thank each and every one of you for being on the call today.
Thank you for setting this all up, Tony. I really appreciate it. I'll talk to you soon.
Talk to you soon. Take care, everyone. Thank you so much.
Take care, everybody.
Thank you.
Thank you. Bye-bye.
Bye.